Hi, and welcome to another installment of the 3-Minute Journal Club, brought to you by the Workwell Foundation's research team. The title of this paper was Subclassifying Chronic Fatigue Syndrome Through Exercise Testing. This paper was published in the Medicine, Science, and Sports and Exercise Journal in 2003. Myself, Chris Snell, David Strayer, Lion Dempsey, and Stacy Stevens are co-authors on this paper. Similar to the paper that was published in 2001 in JCFS, cardiopulmonary exercise testing was used to help describe functional capacity of patients with CFS. This was the last series of trials that was done using a treadmill as part of the cardiopulmonary exercise testing. And as before, ECG electrodes were used for measuring rate and rhythmicity of the heart. Blood pressure was taken manually. And then importantly, for this study, oxygen consumption was measured during peak exercise. Compared to the 2001 paper, we had a greater number of patients with ME/CFS, 189, the majority of which were female. All of the subjects within this study were part of the Hemispherics Biopharma trials for the drug Ampligen. The results, similar to the results we published in 2001, the patients were stratified according to their impairment categories. And again, the impairment categories, according to the American Medical Association, either the none, mild, moderate, or severe, based on VO2 performance on the exercise test. We added a few variables on this trial, but primarily you can see VO2 across no, mild, moderate, and severe impairment is compared to what you would find predicted for that individual. Even in the patients that showed no impairment, they were 20% below what you would consider a predicted value for that person at 80% of predicted. All the way down here in the severe impairment, their maximal effort only produced 38% of the VO2 that would be predicted for each of those individuals. We included some of the cardiovascular variables here. They're resting and peak heart rate, resting systolic and peak systolic blood pressure. And for each of the impairment categories, you can see there's a diminishment in the capability of these subjects to activate the sympathoadrenal system to cause blood pressure and heart rate to go up. And we think that was an important variable to add that produced some of the dysfunction in VO2. And then finally, some of the criteria, both objective and subjective measures for maximal exertion, were not different between the groups compared to impairment category. Again, like the original series of studies, the VO2, or that combined variable that shows functional capacity, was well below what you would expect based on that person's predicted values. And again, in each of the impairment categories, you can see a significant reduction in their functional impairment, especially in women compared to the males. The females had lower than predicted than the males, which may indicate greater functional capacity in females as opposed to males. The conclusion, again, there was heterogeneity within these groups, and this lack of uniformity in the CFS population has been an impediment or a challenge for CFS research for many, many years. Again, it showed the benefits of being able to stratify patients according to their functional capacity so that the cardiovascular and metabolic variables could be compared as well. Similar to the VO2, both metabolic and cardiovascular abnormalities and those mechanisms are described in the paper. Again, these were measured on a treadmill. This is the last series of studies where we used a treadmill because workload calculations, because of differences in efficiency, are difficult. And papers from here on out and our research from here on out used a bicycle ergometer rather than a treadmill. We hope you'll stay tuned to more of the videos from the Workwell Foundation team. Thank you.